Vets, like everyone else in the world, have had to adapt to pandemic times. Today is World Veterinarian Day, and the theme this year is Veterinarians' Response to the COVID-19 Crisis. Now, to discuss how animal care has changed, I'm joined via Zoom by Dr. Leon de Bruyn, the President of the South African Veterinary Association. Very good afternoon to you, Dr. de Bruyn, and thank you so much for your time. So this is obviously a question that it'll change depending on the kind of discussion that you're having, but where animals are concerned, it could be said that they've been neglected in the time of COVID-19 as human beings are trying to survive this pandemic. Could you say the same?
Good afternoon, Morena, and to your viewers as well. Thank you for the invitation to join us in celebrating World Veterinary Day. No, it's certainly been a challenge, and we've had to change the way we practice and the way we meet and the way we educate and treat animals. But I wouldn't say we've neglected the animals. From the beginning of when we saw the lockdown was coming, veterinarians engaged with government and the Veterinary Association in collaboration with the Veterinary Council and Black Veterinary Forum and the Department of Agriculture. We engaged and ensured that veterinary services were declared essential services, and in that way we could continue to tend to the health and welfare of our animals. And we set up veterinary practice guidelines for the various levels of lockdown, so that we could determine which essential veterinary services could still be conducted during the level 5 lockdown and which we could delay. So we certainly have done our best to ensure that the health and welfare of the animals and the people have been optimized and continued during the pandemic.
How has COVID-19 affected the average animal, a dog, a cat? Has there been any effect on them at all, like that there has with human beings?
Certainly. I mean, during those hard lockdowns when we couldn't take our dogs out to walk them, they became frustrated, and we saw increased levels of dogs biting one another in their own families, and when we couldn't walk them on the beaches and had to walk them in other areas. That had effects. And of course the economic impact for those unfortunate people whose services were deemed unessential and couldn't work and suffered financial hardship. Many people had to surrender their pets, which was quite sad. And I also saw on farms when they were during the hard lockdown, the animal care was not as high in some farms as it should have been, because the workers weren't there. And then we did see more diseases and more losses. But as we adapted and as the levels were relaxed, we've seen an improvement in those services.
I know this day is coming at a time of the pandemic, and the focus becomes COVID-19 and how veterinarians respond during the COVID times. But what is the significance of World Veterinarian Day? Why is this a day that the ordinary citizen, the ordinary South African, the ordinary person around the world is supposed to focus on it and care about it?
Well, yeah, what I would say, Morena, is that veterinarians play an essential and crucial role in our society. Our animals are important to us, and both as pets, as companion animals for exercise and relaxation with horse riding and sport dogs, and if we look at through various mediums of work like guide dogs and cart horses, and then traction animals and protection and food-producing animals. Animals are integral in our lives, so that's and we are the custodians of animal health and play a huge role in animal welfare. What's also important is we can't separate human health and animal health and environmental health. We're really increasingly looking at the One Health concept, because we don't operate in our own little compartments. We're all in one area, and we've seen with this pandemic what happens if we mess around and put animals together in a wet market that shouldn't be with each other. That's most likely where this virus came from, that it's jumped from different species, because that's in an unnatural environment. And we see where with the bushmeat trade and destruction of forests, where we see Ebola virus, and possibly that's also where HIV came from, was with us interfering too much with the environment. And vets are ideally placed by our epidemiologists and virologists and bacteriologists to study that disease interface and see where we can prevent these zoonoses, which are diseases that spread from animals to humans and vice versa. So we play a large role in animal health, but also in human health, and in terms of food production as well as emotional state. You know, our pets, it's been well proven that people who have pets and exercise with their pets live healthier and happier lives than those who don't.
Yeah. Doctor, thank you so much for your time.